um, relationship breakups, divorces, financial problems, chronic pain, which is something that I don't find people speak about often enough. Sorry. Persons don't speak about how chronic pain contributes to persons' depression and wanting to eventually do the unthinkable. We have, like I mentioned, violence, abuse, and conflict, or maybe other humanitarian emergencies such as, huge natural disasters. All of these things, in one way or another, our Caribbean people or even our Kittitian people, we are at risk for and exposed to. Who has never experienced a breakup or experienced loss or loneliness? But right now, one of the newest and most imminent threats around is the violence. And persons really underestimate how much of a threat violence can be on the public health and the mental health and stability of a country. If you have violent episodes and volatile situations, it affects many persons on a very, very personal level. Some people can become suicidal based on the oppression felt from violent episodes, even if the violence has nothing to do with them. Just witnessing a violence crime. Witnessing a violence crime meaning that they're now on the hot seat and a possible target for retaliation. Stuff like this can weigh heavily on persons. It's very depressing. It can cause suicidal ideations in even the smallest of our society members. Our children become afraid. They become concerned about bullying even more so in times of tension. So these are things that we really have to take note of and be mindful of. Can we have the next slide? So we're going to have identifying and responding to risk of suicide. So just a second. Some risk factors that we have here mentioned or identified in the flowchart when it comes to men as opposed to women. Problems at home. It seems to me in this particular situation from the flowchart, women tend to be more suicidal when it comes to problems at home as opposed to men who would take suicidal ideations because of working conditions. Whereas women would take more suicidal ideations based on their stability at home. So there is one of the major differences between the way women and men cope with their different stresses. Men tend to value work and career, globally speaking, whereas women traditionally they're homemakers. So if the home is not stable, a woman, I guess, in a stressful home situation becomes more at risk for suicide than a man. Then the other obstacle here is health problems, and it breaks even. Both men and women in this situation tend to become suicidal in some cases as coping mechanisms for terminal or serious health risk or problems. Financial difficulties, men tend to take on the burden and the breadwinner traditionally of a home. So therefore, the chart is saying here, men will tend to take on more suicidal ideations based on financial difficulties or their lack thereof, their ability to provide for their families. Problems with members of the opposite sex, I guess what they're saying here, some women tend to use that as, some women tend to take it to heart more than men when it comes to the opposite sex rejection and stuff like that. I would have thought it was different. I thought men would have been more, I guess, affected by rejection, but the chart is saying here women are actually more affected by rejection of the opposite sex and tend to become more suicidal than men in those circumstances. And for our younger teens and our youths, problems at school where we have bullying. So we have to be careful with our adolescents, what they're experiencing at school. like I said, there are support systems in our public school systems right now to help our youths, but it is still paramount and important for members of the public to be aware of these things and to be able to identify a youth that is at risk. So I said a mouthful just now, and we're going to take a few short breaks, a few short messages, sorry, in a break, and we'll be back to elaborate on the suicide and prevention awareness campaign for 2024. Thank you.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
Good evening and welcome back. For those of you who are just joining us, welcome. And for those of you who were with us from the beginning, welcome back. I am your host, Dr. Lescott. Our topic for this evening is suicide and prevention awareness. For 2024, September 10th would be the Suicide Prevention Awareness Day annually that is recognized the world over, especially by medical professionals and mental health professionals around the world. So we're going to continue our discussion. These are some recommendations from the WHO for reducing the risk of and prevention of suicide. So the first thing they mentioned was reducing access to the means of suicide, meaning if you know you have persons around you, loved ones, anyone around that you might suspect is either suicidal, has suicidal ideation, has been diagnosed with any major depressive disorders, any person that has been diagnosed with any terminal illness or any grave illness, even if you might not suspect that they're depressed about it, you still have to be mindful. Sometimes persons can mask depression very well, especially if they're going through suffering from a particular illness. Sometimes persons might not be forthcoming about their unhappiness with coping with or dealing with an illness. They would become suicidal and you would not even know it. So reducing the access that at-risk persons could have to take in means to take their lives, for instance, sharp objects, knives, razors, anything that can be used as a weapon, anything that can be used to be tied around the neck, those things should be out of reach to persons who we suspect is vulnerable, or maybe a bit emotionally unstable. Another recommendation from the WHO, we need to have more reporting on the topic. Suicide and suicidal ideation is one of the most underreported things or medical conditions that exist right now. It carries a lot of stigma, so therefore sometimes even if a person is being seen by a health professional, sometimes they don't express to these health professionals that they're having ideation. So it's a very difficult thing to treat or to combat if the family is not aware. If the patient is not forthcoming with their ideations, then it becomes next to impossible to recognize and therefore treat. So we need to have more documenting of suicidal ideations and attempts within our private and public health system. I took the liberty and reached out to Dr. Sanchez of our psychiatric ward, and she was gracious enough to allow me to have access to some information. And she mentioned that in the beginning of 2024, we've had 3 suicidal attempts. 1 male in their 20s, in their late 20s, and 2 females, both in their teens. We also had 2 suicidal ideations. Sorry, we had 4 patients with suicidal ideations, 2 males, and 1 male and 3 females. The males were middle-aged men, and the 3 females were actually in their early and late teens. So we need more statistics covering and more specific data to analyze when it comes to suicidal attempts and ideations in order for us as medical professionals to combat the issue professionally, and wholeheartedly with all stakeholders who are involved. We need to have persons taking note of what is happening so that we can trace and track behaviors. When you can trace and track behaviors, it makes it easier for future diagnosis, and we can, I guess, better maneuver in terms of helping future persons if we're able to detect patterns in our society. So other recommendations by the WHO would be early identification, treatment and care of people with mental and substance abuse disorders, training of non-specialized health workers in the assessment and management of suicidal behavior. That's a huge one. I think that is something we can work towards here in St. Kitts in our public health sector. We are willing. We just need the manpower in some instances to, I should say, cope with the changing societal expectations and demands. We also need follow-up care for persons who attempted suicide, and persons would need provision of community support, which is a huge, I think, I wouldn't say it's a missing link, but I think a lot of persons don't know who are the stakeholders and who to turn to if they need such support. I was able to, find some information online when it comes to who or where you can find help in St. Kitts and who you can reach out to. We have a wealth of medical professional persons who are able to remedy and sort through such matters with the public. I have the number right here on hand. By the end of the show, I'm going to ask if that number can be displayed. If not, I will mention what those numbers are and the names of the persons you can reach out to for such support. So in that regard, we're going to take a short commercial break in a few minutes. Just a minute. I'm having some issues with my slide. Okay, so sorry about that. We're going to take the break. I'm having some issues with my tablet. So we're going to take a short commercial break. We're going to have the spotlight, actually. Are we ready for the spotlight? We have I'll introduce the spotlight, which is Mrs. Felicia Faye Liber. That's our personality spotlight. She is a hard and dedicated worker of the Joseph and Franz Hospital at the Eye Clinic. Anyone who is visiting the Joseph and Franz General Hospital at the Eye Clinic will have the very lovely pleasure of dealing with Miss Faye. She is efficient, she's professional, and she's always willing to help. So it's my pleasure to introduce Miss Felicia Faye Liber as our personality spotlight for this week.
Hardworking, dedicated, and diligent are a few of the many words used to describe Felicia Faye Liber. Felicia has dedicated 16 years of service as an ophthalmic clerk at the J.N. France General Hospital. Over the years, she has exhibited exemplary work ethic and has built many professional relationships throughout the entire local medical fraternity. In her role as clerk, Felicia has many responsibilities, including receptionist duties, scheduling appointments, follow-ups, and filing patient charts. Felicia has proven herself to be very versatile, dependable, and pays very special attention to detail in her given tasks. The customer service she gives to her patients is described as second to none. Felicia aims to continue improving in her role and will maintain her dedication.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing, but hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
Good evening again, and for those of you who have been with us from the beginning, welcome back, and for those of you that's just joining, welcome. So we're going to continue our discussion on suicide prevention and awareness. The the last topic, the last segment of the discussion was basically talking about the risk factors. Now we're going to go into the warning signs. For instance, persons wanting to do the unthinkable might speak about it. They would tell you, I want to die. They would tell you, I want to kill myself. That is one of the first things, or some of the things they would tell you if suicide is in fact on their mind. They're talking about feeling empty, trapped, hopeless. They express feelings of despair and general unhappiness. Some of them can display symptoms of depression, like not wanting to bathe, not wanting to just take care of their general well-being, feeling unbearable pain, physical or emotional. They complain about feeling not able to have comfort or peace. Of course, saying goodbye to people or unusual visits and calls to people, getting life affairs in order, such as giving away important possessions or making death arrangements, being insistent on, I guess, formulating a will. Now, that in and of itself does not mean that someone is suicidal, but I'm talking just randomly very passionate about making a will. It's a good indication that this person might be thinking about leaving for good. Taking risks that can lead to death, extreme mood swings, like great sadness followed by calmness, showing extreme anger or talking about seeking revenge, changes in sleeping and eating patterns, withdrawing from family and friends, acting anxious and agitated. Those are all warning signs to look for when you suspect or might be dealing with someone that might have emotional instability or depression, or someone that you know leads a very high stress, high competitive lifestyle. You also have to look at those persons who seem to have it all, who seem to be wealthy, but you know that their work or their professional career is a high impact, high stress type of career. So some myths about suicide would include people threaten suicide to get attention and don't really mean it. I guess that could be a very detrimental assumption. Persons who are feeling deep pain and persons who are generally unhappy with life, I'm sure seeking attention would be the last thing on their mind. They're seeking help, support, solace, and a non-judgmental ear to speak to where suicide is concerned, because it has such a huge stigmatization it carries with it. So persons generally underreport suicidal ideation. So I would really encourage persons out there that if you notice a loved one or a close friend speaks about suicide, please don't take it as attention-seeking behavior, but instead as a call or cry for help, because it's a very serious thing that someone is crying out for help and it's misinterpreted the wrong way, and so the person doesn't get the right medical attention that they may need or the intervention that they may need. So we can try not to be judgmental of those who speak of suicidal ideations. Another myth is asking someone about suicide will put the thought into their head and will make them more likely to kill themselves. That may not be the case either. Sometimes these tough conversations need to be had, and so getting rid of your own personal prejudice is a huge help, and it removes that barrier for you to communicate more effectively in a non-judgmental fashion to someone that might be suffering in that regard. Another myth is anyone who talks about suicide or takes their own life is crazy. I don't encourage persons to use that word crazy. It's a very loaded very emotionally loaded word, can be misinterpreted, grossly misinterpreted. So I don't encourage the use of that word, but that's not true. Thoughts about suicide are not uncommon at all. Most suicidal persons are not psychotic or insane. Suicidal people are hopeless, experiencing extreme distress, and do not see another way out. So that in no way means make the person crazy or is an indication of any, I don't know, insanity. Okay? So some tips we can use when we're speaking about suicide or suicidal ideations to someone that we suspect or might know have this issue. Talking about suicide can seem scary for many. It is helpful to start discussing by saying these can be some of, I'm just giving examples of some ways you can approach the topic. You can ask questions such as, when did you start feeling this way? I want to be able to help you, and you're not alone. You have to reassure these people that they're not the only persons that might feel this way. As I said and mentioned before, suicidal ideations and suicidal thoughts are really not as uncommon as persons might think it is. So if you really want to help someone with suicidal ideation, it really helps to reassure them that it's not uncommon and they're not the only persons who probably feel like this. Have you thought about getting help? Do you have any thoughts of hurting yourself? It can also help to share that you are not alone. I am here for you. It may not seem like this right now, but this feeling will get better. I may not know exactly what you're feeling right now, but I will be with you as you go through this. These are some of the examples of the helpful phrases you can relate to someone who you know is struggling or going through a tough time with suicide or suicidal ideations. You yourself, as the individual approaching the person, it would help if you remain calm, non-judgmental. You show compassion and empathy. Speak in, like I said, a non-judgmental fashion. You listen more than you speak. Be authentic, be yourself when you're approaching the topic to the person. Be sympathetic. Offer hope and support. Take the person seriously. Let them know that you hear them and you understand where they're coming from. Points to note, things you should avoid. Don't argue or disgrace the person or act as if you're so shocked. Try to fix, or like you're trying to fix their problems, or blame yourself or another person for what the person is going through. Promise that you won't tell anyone, as in order to get this person help you may need to. So you can't promise not to tell anybody, because you may actually need to tell someone what this person is going through in order for them to get the help that they need. So in order to drive this point home a bit more, I prepared a youth suicide prevention clip for you, the members of the public, to absorb and reflect on.
My son was successful and had friends, but during his junior year, he started to withdraw from everything. He eventually attempted suicide. We were shocked.
Our daughter came to us very upset and anxious. She said she had no future and she wanted to die. We were able to talk it through that day, and she was okay.
My niece struggled with depression, and in her freshman year, she lost 25 pounds in a month. She got some help, and we later learned she had been thinking of suicide. I'm so glad they helped her.
After a suicide on his team, my son was confused, sad, and angry, but he didn't want to talk about it. When we did talk about it, he admitted that the whole team was struggling. I'm happy we were able to be there.
These are the voices of people who have been impacted by suicidal thoughts or behaviors in a young person in their lives. Suicide is the second leading cause of death for young people between 10 and 24. It is one of the most challenging and frightening topics to talk about for a family. It's also more important to talk about than anything else. Keep a few important things in mind. Suicidal thoughts are common. If a young person experiences suicidal thoughts, he or she can feel scared and too ashamed to talk about them. While thoughts are always a concern and can be warning signs, suicidal behavior is far more dangerous. When young people find out that suicidal thoughts are common, they often feel relieved to know that they aren't alone and they aren't going crazy. Suicidal thoughts are usually temporary. Most people with thoughts of suicide only experience them for a short time before they pass. Even if they return, young people can learn to cope with temporary distress and manage their thoughts and discomfort. When youth can cope with and manage bad news, bad moods, difficult social interactions, or simply the awkward task of growing up, they tend to think of suicide far less frequently. It's okay to talk about suicide. Asking a young person, "Are you thinking of killing yourself?" with a calm, confident tone sends a very important message. It conveys that it's okay to talk about anything. It can provide hope and relief to a young person who is feeling hopeless. Treatment works. Youth can experience relief and a reduced risk of suicidal thoughts and behaviors.
Here are your Hartford Value Mart IGA specials.
Running August 22nd to September 4th.
Now, our Value Club Blue Tag specials. Essential everyday barbecue sauces, just $7.99 each. Act 2 microwave popcorn, just $7.79. Essential everyday shredded and chunk cheeses, $7.99 each. Red Baron French bread pizzas, $13.99. Stone Ridge ice cream sandwiches, $19.99 each. Essential everyday reusable containers, $15.99. And now our very low weekly
Value deals. Essential everyday pasta, $4.99. Essential everyday pasta sauce, $9.99. Essential everyday apple juice, $7.99. IGN Essential everyday peanut butter, creamy and crunchy, $8.99. IGN Essential everyday table salt, $4.79. Soft soap, liquid and soap, $9.99. Shop smart, shop Value Mart. Tell them in Spanish.
sea listo y haga sus compras aquí en
Value Mart.
And welcome back. Good evening. I am your host, Dr. Lescott. For my returning audience, welcome back. For those of you joining for the first time, welcome. We're going to just wrap up our discussion. Our topic for this evening was suicide awareness and prevention. There's a Suicide and Awareness and Prevention Day observed on September 10th, 2024 of each year annually. Just to recap and to wrap up, suicide is more common than we would want to accept. The world over, it's the fourth leading cause of death next to non-communicable diseases, and so therefore more common than what we would, I guess, want to admit, globally speaking. And so therefore it's important that we have awareness, sensitivity, and learn how to prevent these behaviors for our future. Definitely depends on it. So quickly, if you or anyone that you know is suicidal or has suicidal ideations, what to do if you're having suicidal thoughts. If you're having thoughts of hurting yourself, get help quickly. Know that good treatments are available for you. Although sometimes we don't talk to physicians about mental health, they can help to support evaluation and sometimes medications. Physicians can also refer you to a mental health professional specifically trained to help those with suicidal thoughts and behaviors. Seek help from trained mental health providers. Dr. Pereira is one such person. Her number is 668-4646. She has a hotline. She's always readily available. She has an online platform that you can message her, and her response time is very prompt and quick. There's also the hospital. You can come into the JNF hospital and let persons in the emergency room know what you're experiencing, and I'm sure they'll be happy to assist and refer you to the psychiatric evaluation physician on call. So that tonight has been our show. I thank you guys for tuning in. It was a pleasure. I hope that the information given is helpful and persons are able to utilize in the best way, because I know changes are inevitable, but we must learn to cope with those changes. Changes are a must in life and a constant in life, and so learning how to cope with said changes are paramount to our survival as a people here in St. Kitts. And so we must remember to be supportive, lend a listening ear, be non-judgmental, and help someone who you know might be suffering or struggling. Have those difficult conversations, and let's strive for a healthier St. Kitts and Nevis. Thank you.